Hello, welcome to another episode of Clean Health. My name is Dr. Oby Coucou, a West African trained cardiologist and a member of the Endocrine and Metabolic Society of Nigeria. Today, we'll be talking about diabetes, the silent killer. We'll explore the possible symptoms and signs of diabetes, as well as the complications of type 2 diabetes, both acute and chronic, and the role the family has to play in management of diabetes. Stay tuned as we come back.
Diabetes is on the rise and trend. Millions of people dying every day. It's a silent killer. So much glucose in the blood lead to insulin, leading to stroke, heart attack, kidney failure. On the diet, exercise, goals, monitoring. We've got to stop this trend. We've got to slow it down. Control diabetes, control diabetes, control diabetes, control diabetes. On the diet, exercise, goals, monitoring. We've got to stop this trend. We've got to slow it down. Control diabetes, control diabetes, control diabetes, control diabetes.
Welcome back. How do you know you have diabetes? Frequent urination, okay? What is referred to as polyuria. Increased tests, so frequent drinking of water, all right? Excessive weight loss, okay? Increased intake of food, excessive hunger and increased intake of food. Sometimes the person could have recurrent skin balls or skin infections, okay? And then they could also have wounds that are difficult to heal. So what actually happens is that when there is a high blood glucose level, it creates an osmotic environment that causes blood sugar, that causes water to move to the kidneys. So they would have this tendency to urinate frequently. So you see some patients present to us complaining, "Oh, doctor, I used to urinate 2 times in a day and then once at night. But of recent onset, I noticed that I urinate more frequently in the night, up to 4 to 5 times I wake up urinating, and I'm worried." Although there are other causes of excessive urination, like infections, urinary tract infections, okay, and other causes, but usually that's one of the commonest symptoms, all right? And then I tell you, okay, as you know, what happens actually is that as you urinate, okay, what the body does, the glucose, excess glucose or sugar in the blood will create an osmotic environment so that water is being drawn to the kidneys. Now, as you're losing water, there is a feedback mechanism that goes to stimulate some cells in the brain, some centers in the brain called the test centers. So the next thing, they feel thirsty. Test centers say, "Oh man, I'm thirsty. What's happening? I'm thirsty." So you see them drinking a whole lot of water. As they drink a lot of water, you find out that the person says, "Doctor, I tend to be hungry a whole lot." Because what happens, there's excess sugar in the blood, but the cells are starved of sugar. They're not getting the sugar because the insulin is not being taken into the cells to be used. And so there is what? There is starvation in the midst of plenty. So the cells are starved, they send signals to the brain, and then the person says, "I have to eat," and they keep eating, okay? And then because there's excess sugar in the blood, the cells are being starved, they're hungry for food. Without food, the body cannot perform. Without food, you cannot have energy. Without food, the brain cannot function. So what happens is that it will give signal to the liver to produce energy from other sources. So there will be generation of energy, breakdown of fats, breakdown of the fats that are stored in the body, in the fat cells. There will be breakdown of protein, okay, and so on to generate sugar. All right, so the person will begin to lose weight. All those fats that are stored in the fatty areas of the body begins to go off, okay? So the person despite the fact that he's eating, he will be losing weight. So those are some of the symptoms that you would recognize and then present to your doctor. It's better to see a specialist who can manage it properly. Now, we'll go to what are the possible complications. The complications of diabetes are vast, okay? It can affect any organ in the body, ranging from the brain, okay, to the heart, to the kidneys, okay, to the blood vessels, to the nerves, to the foot, to the skin. So every organ in the body is affected, all right? And those complications can occur acutely, okay, that's in the short term, or chronically over a long period of time. You could have complications, all right? Now, if it affects the brain, the person can come down with stroke, all right? If you see a patient come to you, say, oh, doctor, I cannot move. I woke up suddenly, early in the morning. I wanted to perform ablution or do some prayers or, have my bath or go to the toilet to ease myself. And I noticed that I couldn't move one half of my body, okay? So that is called stroke. One half of the body cannot move, all right, as a result of a complication of diabetes. It can also cause memory loss. So people with diabetes have memory losses, what is called dementia. They can have Alzheimer's disease. So, but that's a big terminology, right? Let's take it down. You can also have problems with the heart. They can have heart attack. You know that what is heart attack? Sudden what? A person all of a sudden has severe chest pain that is so excruciating. You feel like dying, the worst kind of pain, squeezing in nature, you understand? That can, you cause the person to feel as if he's going to die, and comes in suddenly. So that is called heart attack, all right? I don't want to break it further down, but just to have an idea. They could have heart failure. What is heart failure? The heart can no longer pump blood adequately to supply food and nutrients to the organs on the body, right? So how does the person present? They'll tell you, oh, I have shortness of breath. I feel breathless when I walk a short distance. I feel breathless if I climb a stair. I have to stop because of breathlessness. They tell you that it has been progressing over some time, and recently, even at rest, they're breathless. Sometimes they tell you they cannot lie down flat on their beds. They have to wake up breathless. They will need to use 2 pillows to sleep on, okay? They could have cough, okay? And they're unduly aware of their heartbeats, unduly rapid heartbeats, Those are some of the symptoms of heart failure. Then associated with leg swelling. They come in with leg swelling. Those are the symptoms of heart failure. Other complications involve the kidneys. So because of the long-standing diabetes, you find out that the kidneys begin to leak protein, right? So with leakage of protein in urine, the person will be urinating protein and then losing protein. So they tend to have what? Swelling, body swelling, which starts usually from the face. So they can tell you, doctor, I woke up early in the morning and I noticed my face is swollen. Now the face is swollen early in the morning, and then as she moves around the day, the facial swelling regresses, okay? They tell you, I have reduction in urination. My urine output is reduced. I cannot urinate, like I used to urinate before, and they have generalized weakness and body swelling. So those are the symptoms that can give you an idea that you have a kidney damage from diabetes, okay? Also, it can affect the eyes, all right? So they could have eye problems, okay? Sudden blindness could occur. Is one of the commonest causes of sudden blindness, second to trauma. So that's why it's very important that once every year, all diabetic patients should see an eye doctor to check up their eyes for proper management, okay, and to prevent the progression of eye damage, okay. They could also have the nerves that are affected, okay. The nerves could be affected. They tell you they have numbness. Doctor, I cannot feel my hands, I cannot feel my foot, They feel as if sometimes they're walking on pebbles or walking on, foam, all right. Sometimes as they walk, the slippers go off and they don't know that the slippers has gone off, So, they have some abnormal sensations. Some have tingling sensation, pricking sensation, pins and needles sensation, choking them all over. Their lower limbs, their feet, their hands, and so on. So they come complain to you. Some have pain under their feet. You have pain under your feet, So those are some of the complications of the nerves. That's why it's important that the feet be checked up every 6 months. In all diabetic patients, you should go for checkup. Your feet should be examined, monitored. You should know how to take care of the feet. Okay, wash it carefully, cut your nail. The nail should be cut by your relation, all right? And look in between the toes to make sure there are no fungal infections of the feet, or to make sure that the feet is oiled, properly oiled, okay? And then prevents some of the complications, because sometimes they could have a needle prick or injury and they don't know. They're walking about and that will become a wound or an ulcer, which is difficult to heal, okay? That's when they now present to you in the hospital. You understand? So those are some of the complications. It can affect the skin, all right, and lead to skin infections, okay? They could have infection of the skin, recurrent boils, okay? They could have recurrent chest infections, all right? That's why it's important for diabetic patients to receive pneumococcal vaccine. There's a vaccination called pneumococcal vaccine. You should have it every 3 years or so, you know, so as to prevent infection, because they are at risk of infection. The the bacteria likes sugar. Sugar in the blood is high. Bacteria like sugar. So they tend to have infection in every system. You could have urinary tract infection, okay? They could have brain infection in every part of the body. So you have to be careful. You don't expose yourself to a dirtier environment or where you can easily get infected. All right. Then, so those are summarily, those are some of the the long-term complications of diabetes. It can also, I said, it can be acute, okay? For instance, they can come down with hypoglycemia, low blood glucose levels. And if the blood glucose level is low, okay, for instance, a patient who is diabetic can have low blood glucose levels as a complication. All right. And in such an instance, for instance, if they take excess insulin, overdose of insulin, or they skip their meals at night and they're taking the insulin, or they do some exercise that is more exercise, it can enhance the use of insulin in the body. So what will happen is that they'll have low blood glucose level. And that's why we advise all diabetic patients, if you want to sleep at night, make sure you have your sugar by your bedside, at least 3 cubes of sugar or half a bottle of Coke. Why? So that in such an emergency, when you see the person is trembling, these are early symptoms, feeling of trembling, you know, with weakness, hunger pangs, hungry, the person is hungry excessively, and then, you know, headaches, and the rapid heartbeats and so on. Those are the early symptoms before you get to convulsions and then maybe unconsciousness, which is the later part we don't want them to get to. So we advise them that they should take 3 cubes of sugar and keep at the bedside. So if they notice such symptoms, check your blood glucose at home with your glucometer. You see it's going low, immediately you take up the sugar or you drink the half bottle of Coke, look for food to eat, and then, of course, bring the patient to the hospital to see a specialist so that we avert such complications, because it can be deadly if the person goes unconscious, which we don't want, okay? Then they could have hyperglycemic emergency. They could come in with an emergency state, okay, where they come in comatose and so on. So this brings us to the end of this episode. Thank you very much for watching. You can subscribe if you've not subscribed. Click on the like button. Lay your comments in the comment section and share these videos to as many as possible so that people will be educated. And we'll see you in the next episode. Thank you so much.